Hi, good day. This is Dr. Ramakrishna from KIMS Hospitals, Kondapur. I am the head of Surgical Gastroenterology, Department of Surgical Gastroenterology, Laparoscopic Surgery and Bariatric Surgery. Today, I would like to talk to you about obesity, or what we do here is weight loss surgery. Obesity, as you all know, is growing in prevalence day by day. Why? Because of our lifestyle. The amount of exercise has come down drastically, the amount of comforts have increased very much, and junk food, as you can see every nook and corner of the city, where you can get whatever you want and you just rely on that. But what is the saddening factor is that we are seeing obesity and definite lifestyle diseases in very young professionals, and that too in the IT sector. I am seeing diabetics who are hardly 30 years old, hypertensives who are hardly 25 years old, and people with gross morbid obesity, that is the BMI is the body mass index, which is beyond 40 in people who are less than 35. Recently we had an opportunity to operate on a person who's 14 years old and who was 124 kg. Can you imagine a 14-year-old kid being 124 kg? So we had to do the bariatric surgery, and the weight loss surgery resulted in a weight loss of about 30 kg. That is, now in the last recording he was 96 kg. So we are seeing obesity at a much younger age today. What we used to see at the older ages in the previous generations is now being seen at a younger age. That is putting a lot of stress on the medical fraternity as well as the work hours which are being lost because of the lifestyle diseases. Most of these patients land up with some kind of an infection which takes a long time to treat, or develop issues with their joints, or sometimes develop sleep apnea, or very young age people developing heart attacks which require interventions. So their body is getting older much faster than their real age. And diabetes. As you all know, diabetes is a disease which is defined in a very simple way, that the body ages much faster than your real age. So for example, a 40-year-old person will have a 60-year-old body, and you expect it to get sick. So that's why 40-year-old diabetics who do not take care of themselves fall sick. So what happens with weight loss? What happens with weight loss is that when you have a BMI of less than 30, then okay, I would say that you have to put in an effort like exercise, diet control, and you could control your weight to a certain degree. But beyond 30, I would say even up to 32 that could be possible, but beyond 32 BMI, usually you get into the category where you require surgical correction for your weight loss. Though the international standard says that beyond BMI of 35 is the stage at which you should think of operating on a person, what they say is that 35 to 40 BMI is the stage where you operate on people who have comorbid factors. And beyond 40, even if they don't have comorbid factors, you have to operate on them. So what do I do for this weight loss? We have a definite protocol system that we follow in our department, where a patient is put on a liquid diet for close to a month before his surgery. This is to see that whether the patient is really willing to go through the whole process of weight loss surgery. 2, whether he is going to be compliant for our requirements. 3, for us, so that surgically the liver sheds the fat much faster than the rest of the body. So when I operate, the liver becomes very supple and the surgery becomes much easier. So when we take him up for surgery, all necessary precautions are taken, and we have an excellent team of anesthetists who take care of my obese patients. Or rather, I would say my record of the most obese patient was 184 kg. We had operated on him, and now he has a BMI of 32. and I expect him to come down to a BMI of 28 in about 6 months' time. So in the same way, what we do is usually is the sleeve gastrectomy, which is the most commonly preferred procedure, especially for Indians. The reason being that Indians are bulk eaters. They like to eat a lot, and they eat a lot of rice, for example. So this adds to the stretch of the stomach, and some of these stomachs are close to 2 liters in size. So what we do is we downsize the stomach, bring it down to anywhere between 60 to 90 ml, so that the patient cannot eat more. At the same time, we do a hormonal manipulation by taking out the fundus of the stomach or upper part of the stomach, where the hormone, which is called as ghrelin, which is a hunger hormone, is released. So we disconnect it so that the patient no longer feels hungry. So by this mechanism, the food passes through the normal pathway, but at the same time, the less quantity of food that he takes makes him shed all his fat. And after surgery, he has to be on a liquid diet for close to a month and then start off on a soft diet. So the weight loss will be very high in the initial post-op period, but I would stretch it to a limit of 2 years, where I would expect my optimal weight for the patient to be achieved if he follows my instructions. And it is mandatory that they should be on regular follow-up with us. Other surgical conditions, for example, like a gallbladder surgery, we remove the gallbladder, ask him to go home. I don't expect to see him again. But in weight loss surgery, patient has to be on regular follow-up so that we can do any correction of his minerals, electrolytes, or vitamins. This is mandatory, which is required because most of these patients develop anemia, develop vitamin deficiencies if they are not properly counseled. Also, an exercise regime is put on them from the 2nd month onwards so that they build up a good body instead of feeling or having a sickly look after weight loss. Now coming to the surgical procedures that we do regarding weight loss. One, like I told you, the sleeve gastrectomy, or we do the mini gastric bypass. Nowadays, we have come to a situation where we are having to redo bariatric operations or weight loss operations. That is, people who have been operated elsewhere for weight loss have regained their weight for various reasons. So either the stomach has not been completely resected, or probably the patient has been taking liquid diet, that is alcohol, for example. So we do the counseling part to them, and then if required, redo surgeries to remove the excess stomach or do a conversion to a mini gastric bypass. So this is as far as our weight loss program that runs in our hospital, and it is a program for which the patient has to be 100% compliant. Thank you for your patient hearing.